Hello and welcome everybody. And today I'm very pleased to be introducing Sandra Mikhail, who is a dietitian that specializes specifically in the gut health. And she has a new book out called The Gut Chronicles. And the aim within the book is to actually simplify this area whilst maintaining clinical evidence with her integrity with her research. Now, I had a lot of words there, but I think what I got over, what the point I was trying to say is that it is clinically based, her evidence, but it's very simple to read and understand the book. And I think what it does, it really does empower the patient by giving the patient knowledge to understand what is going on. So welcome, Sandra.
Thank you very much for having me, and thank you very much for that lovely little introduction about the book. I think that's a fabulous review, and it's exactly what I wanted to portray when it came to writing the book.
Yeah, so the book, I mean, I can't believe it covers so many areas, literally from the top down to the bottom. And I've just listed a few here. So there's a reflux, bloating, constipation, diarrhea, IBS, irritable bowel syndrome, food intolerance, and hemorrhoids. I mean, all is covered, all which actually I found very interesting to read. But I know what we're going to talk about, or we're going to start talking about, is actually how you'd like people to read the book, i.e. not cover to cover, but dip into the things, areas that you like. And we're going to actually look at three particular areas. But just to start off with, it would be great if you could do a little introduction to yourself. But the one bit that I just wanted to put in that I really enjoyed within the book at the beginning, and it shows that I must have been rubbish at biology because I kind of missed this. At the beginning, you've got a great diagram of the whole tract all the way down and explaining what each part of our system does. And I just found, God, that's so simple. I get it now. I get what the large intestine is, and the small one, and where they are, and what they do. I just found the basic information so interesting and sort of grounding to move them forward onto all these different areas.
And that's honestly throughout the whole book. So my main aim was just to make sure that I'm simplifying the science, or how am I going to communicate the science into words and information that are easy to digest, and for people to actually learn as you go. And just like you mentioned, I mean, when it came to writing the book, firstly, one of the questions that I get asked a lot is, who is the book for? I will say, like, it's for everyone that's really interested when it comes to gut health, but it's for everyone that's felt confused when it came to struggling or dealing or trying to manage one of the most, the 7 most common gut conditions we tend to suffer from. And those are the ones that you just listed. So that will be one thing, because if you had to look at the area of gut health at the moment, it is a rabbit hole of misinformation. So the amount of conflicting advice that you'll be getting, people are just left confused and helpless, really, or they just have no longer, no idea how to approach, because one person has told them to eat this certain way, and then the other person has told them they need to eliminate all these foods that they've been including. So again, the main aim is to help people navigate this world of misinformation when it comes to gut health. The other sort of target group are perhaps people who need dietetic assistance or need nutrition support, but because of the long waiting lists and times to actually see a dietitian or registered nutritionist, they again might be left to their own, whether they're researching online. So it could be a good starting point for people to just grab this book and see, right, how do I get started? Now, the way I've written the book is I wanted to make sure that the reader ends up reading the chapters that they can relate to. You don't have to read the whole book. Ideally, you can, but you don't have to. You can just pick the chapters that call out to you. So if you're struggling with diarrhea, you go straight on to the chapter that's on diarrhea. If you are trying to navigate your journey with irritable bowel syndrome, then there's a whole chapter dedicated to that too. So I made it in a way that it is easy for the reader to navigate, where they don't have to read it page to page, because if there's certain, bits and bobs that they've missed at a specific chapter, it will take them back and refer them to that page that they just need to read.
I think it's also, though, quite hard to know what might be the problem. And that's why the book is quite good, that yes, if you know that you've got IBS or you've self-diagnosed, for example, it's also good to read the other things surrounding it, because you might then identify, well, actually, these are really what my issues are, and it's not what I first thought it was.
Exactly. And I think the book also highlights the importance of avoiding self-diagnosing, and even just talking about the diagnostic process, just to help, the readers understand, right? If I were to, get investigations, what are these investigations? What do they mean? Why do I need to get a stool test? Why do I need to check for inflammatory markers? So I think it's also really important, just like you said, to empower the person to actually know, why should I be getting these tests? Should I be requesting them? How do I communicate my struggles to my doctor? And actually, what are the red flags? If I'm experiencing bloody poo, should I just wait or go, or seek help right away? And that's, one of the mission of, I'm not going to say mission statement, but a big part of my mission with the book is to really normalize poo talk. We laugh about it, all jokes aside, but it can really save a life. And we've seen that. We always say, there's a saying in the book, I'm trying to remember, like, a little bloat never killed nobody, but a lot of uncomfortable bloat with, change in bowel movements has. So I think it's just normalizing all these things. I dedicated a whole chapter on hemorrhoids, and I didn't think I'm going to have so much to write on hemorrhoids, but it's also one of these conditions that are extremely common, but no one speaks of, because there's this massive taboo or shame around such conditions.
And I think that probably brings us back to the very beginning, because we haven't mentioned where you practice and some of your background, because all of the words that you've mentioned were things that you were brought up as a child.
Exactly. So I'm actually the daughter of a gastroenterologist. So growing up, talking about poo is completely normal. I grew up listening to things like rectal bleeding, anal fissures, endoscopies, and so on. And that, to me, it was funny just, thinking about it back in time, but it's just one of these things that, as I've grown up, there's absolutely no shame to seek help if I'm personally dealing with any struggles or noticing any changes as well. And this is something that I really try to promote in my practice with my clients and across my brand as well. So I've also, been diagnosed with irritable bowel syndrome, or IBS, when I was 25, and that was extremely debilitating. So this is one thing that I would say, don't your gut symptoms, no matter how mild or severe, need to be vocalized and spoken of out loud.
And I think also why it's so important is because they can so affect everybody's quality of life. I.e.,
absolutely,
they don't go out. They have to be very careful what they might wear. I mean, over a long time, if that's not treated, the mental health issues behind that are huge.
Absolutely. So I remember when I was diagnosed with IBS at the age of 25, so that's a while back, but every part of my life got impacted. So my social life got hugely impacted. There was this fear of eating out as well. The stress of not knowing what's going on, the stress of not knowing where the next bathroom stop is going to be. So even just driving down that freeway, I just needed to know, right, where my toilet stop's going to be. So it's always easier for me to just say, you know what, I'm just going to stay at home, just, completely isolate myself. And this was going on for about a year. And, a lot of people would say, but hold on, you're a dietitian, you would have, picked that up. You could have managed things yourself. I did, the symptoms that I was experiencing were so severe. I classified them as severe, that I didn't think food was a big part of it. And this is, when we do talk about IBS, if you do want to talk about irritable bowel syndrome, it's one of these conditions that people feel stigmatized, that you don't realize how it can impact your quality of life, just because, anatomically everything is fine. You go in for tests and, the doctors would perhaps say the famous few words, it's all in your head. And that just makes you feel unheard, and it just delegitimizes, the severity of this condition. So this was also actually my push, I'm not going to say to specialize also in gut health as well. But it was definitely a big part of it, definitely played a role.
So and I know that you're actually based in Switzerland and you see
Yes.
people physically, but also you have a clientele around the world because you were based in Australia and you've got, I think it was the word affinities or whatever to people in the UK as well. So you're pretty everywhere. When people, come to you, what is, what is the most main, do people actually know what they think the problem is, or is it more about describing the symptoms and then asking you, okay, what do you think, Sandra? What should I be doing?
So generally speaking, we get clients referred by doctors. So,
Right.
they would have seen a specialist or a gastroenterologist, and this is how they refer them to us. However, a lot of the clients that we get as well have been to 20 or 30 different types of specialists, and they still cannot figure out what was going on with them. So I feel like sometimes my role here, again, keeping within my scope of practice as a clinical dietitian, is, nutrition is still at the core of what we do, but perhaps it's even just connecting them with the right professionals as well. So maybe they've missed on the right type of therapy. So for example, we have a large amount of, let's say, clients that come in with irritable bowel syndrome, but they do not even address the mind pillar. So this is, one of the things that we would say, look, I'm that middleman that helps connect people to perhaps getting a second opinion from another gastroenterologist, helping them kind of filter through 15 years worth of medical information and just seeing, where do things currently stand, what potentially is missing. And, a lot of the times as well, we do get a lot of clients with suspected food intolerance, and food intolerance is very, very difficult to diagnose. So you do need to, have worked in this area for quite some time to build up the experience, because you just end up being, you call you the food detective. So a lot of our clients that we see either come through doctor referrals, word of mouth, our website, either with a diagnosis already from their specialist, which is a gastroenterologist, or suspecting XYZ. And this is perhaps if they haven't seen a gastroenterologist. My role is to refer them to one, but also to describe what sort of tests are we looking for? What am I trying to rule out here? If perhaps, a lot of the gut conditions that I mentioned in the book, or even just organic causes for these different symptoms, like tummy pain and bloating, a lot of the symptoms tend to overlap. So, for example, one thing that we see is many clients who've been diagnosed with irritable bowel syndrome actually have small intestinal bacterial overgrowth, which is SIBO. So they perhaps might have been misdiagnosed because maybe they didn't have access to the right diagnostic tools. So there's a lot of things that we do as, let's say, dietitians here in the private practice is, yes, nutrition is at the core of what we do. People already have a diagnosis, come to us, but if they don't, we're here to help refer them out and start to create this communication channel between, the support team, as I call them, that multidisciplinary team. So it is a lot of work.
Yeah.
But it gets people, as I said, at the end of the day, we all have one end goal, and it's our patients' or clients' well-being.
Absolutely. So what we said was, because there is so much to talk about, and I know that a lot of our community would be interested in absolutely every single topic. So we've chosen 3 to have a little bit more of a deep dive into. And I think that was IBS, bloating, and food intolerance. So I don't know which one that you'd like to start with.
Well, look, we can start off with the bloat purely because it is a symptom of all the other two. But bloating tends to be one of the most common complaints that I feel everyone has mentioned or has complained of. We've all experienced it. And it's funny enough, despite being so common, I'm not going to say it's poorly understood, but it's not so straightforward. So my first step there is to normalize the bloat. I know a lot of people would say, what are you doing? Actually, there's this unrealistic expectation for us to walk around with, washboard abs, not bloated at any time. We always have to beat the bloat. But actually, if you had to look at it, bloating is a, let's say, normal physiological response to digestion. We all bloat, we all produce gas. So obviously, what is not normal is chronic bloating if it's been prolonged or going on for a long period of time. But to take one step backwards, everyone that struggled with their gut for a very, very long time no longer know what a normal bloat is. A lot of my clients would tell me, Sandra, we have no idea what's normal anymore. So one way that I get my clients to sort of work out what is normal is to use a scale and to rate their level of discomfort. So using a scale from 0 to 10, 0 being no discomfort, 10 being extremely uncomfortable, I need to see someone. Now, if you score 0 to 5, I always say, look, that is actually just reflecting normal processes of digestion. You probably have had maybe eaten too fast. You've had too much fiber. You've eaten too much. These tend to be quite normal. So if you're scoring 0 to 5, don't worry about it. Now, if you score anywhere between 6 to 10 consistently, this is where I would say, look, it's definitely worth looking into and to address the possible causes. Now, I tell my clients, if you have been scoring that level of discomfort consistently over 6, but it's also accompanied by things like tummy pain that's not relieved when you go to the loo or sort of, let some gas out, and you notice a change in your bowel movements, whether it's bowel movement consistency or bowel movement frequency, see your specialist. Do not wait. So this is sort of a good way to sort of, gauge, right, what is normal, what is not normal. Now, if we had to look at the causes of bloating, or let's say the organic causes of bloating, they're extensive. I'm not going to say, I can sit here for about a half an hour listing all these different causes, but I would say organic causes would be things like gut conditions, for example, celiac disease, irritable bowel syndrome, certain food intolerances, pancreatic conditions. So there's a whole ton of things that could potentially contribute to the bloat. But a lot of the times when we're looking at these organic causes, they're accompanied by other symptoms and not just bloating as a standalone symptom. If I had to reflect at my practice, and I know a lot of dietitians working in this area would agree, the most common causes of bloating that we see would be constipation and lactose intolerance. So I would, if you had to pick the top two, again, this potentially is anecdotal, but this is just purely based on my practice and a lot of other dietitians as well.
Gosh, that's kind of interesting because I don't know if why would I've necessarily known that, but yes, that's kind of interesting about the lactose in particular.
Well, I mean, if you had to think about it, so again, when we look at addressing these different let's say therapeutic or management approaches to bloating, obviously the key here is knowing the cause. So that is generally the first step. So your management plan will purely be dependent on whether you've had a diagnosis of XYZ. Now, regardless of whether it's an organic cause or a functional disorder, meaning if there's a glitch in how your gut and brain is communicating, causing, the bloat as a potential symptom, your management approach will include one or more of, let's say, specific target areas. And these areas are things like adjusting your fiber intake. It could be your eating behaviors. That's one thing that people neglect a lot of the time. Artificial sweeteners as well, because they're literally in a lot of food products right now. Lactose, and then we look at these fermentable sugars in our diet called FODMAPs. So generally speaking, if you've had to address bloating at some point in time, you might need to address one or more of these different target areas. Now, lactose is one. And again, we can talk about lactose intolerance in a bit more detail, but just to kind of give you a snapshot, lactose is the sugar found in milk and dairy products. Now, lactose intolerance, you are unable to tolerate, let's say, milk and dairy products purely because our bodies are potentially not producing enough of a specific enzyme or compound we need called lactase to break down the milk sugars or the lactose. Now, I'm not sure if you know this, but this is also, we've had that at uni when we studied lactose intolerance. Lactose tolerance, so to actually be able to tolerate lactose, is a genetic mutation that is, that has sort of been, more pronounced in, let's say, European and Northern European countries with a very strong farming background. But actually, lactose intolerance is considered normal. So as we age, we do know that we start to produce less and less of this lactase enzyme. So generally speaking, this is why a lot of, let's say, our older clients, start to notice, hold on, I don't tolerate milk and dairy products as much as I did in the past. So this is where I would say, lactose is one of these, it's a very, very common, you can call it food intolerance or an enzymatic food intolerance because we don't produce that specific enzyme. The other thing, so if we had to look at, I think, and the reason why I want to bring this up is fiber. Now, we all know we need to be eating a decent amount of fiber for good gut health. But actually, how much, I always say you need to find that sweet spot of fiber where it really works with your gut and not against it. With the rise of, let's say, plant-based eating or even veganism, let's say, what we had a lot of people come to our practice with is extreme bloating, sometimes constipation or diarrhea, because they've made that switch to a more plant-centered or plant-based diet. And obviously, if you think about it, the general, let's say, Western diet is not super high in fiber. So on average, you might be getting anywhere between 15 to 20 grams if you're lucky. But if you're switching to a more plant-centered diet or plant-based diet, you're probably upping your fiber intake all the way up to about 35 to 40 grams of fiber per day. And that's just way too much bulk coming in too quickly in such a short amount period of time that can cause digestive issues. So this is where I would say, when it comes to, we talk about fiber, we talk about increasing our fiber intake, but it needs to be done strategically and gradually. So even in the book, I do mention like my 4-week strategy of how to increase your fiber intake. So this is where I would say, bloating, can that be because you've made the switch to a plant-based diet recently? Could that be the culprit? So that's just too much fibers coming in such a short period of time.
And I was going to say, and when you're talking, it does make sense to, you read the book and go, right, that's it, I'm going to be plant-based from now. But your body does need to have a bit of time to get used to how you're changing it.
Exactly.
It's a bit like you can't suddenly go and do a whole load of exercise and not have repercussions from it the next day or the day after. It doesn't kind of work like that, does it?
No. Not at all. It's not an all or nothing approach. I think what's really important, especially when it comes to fiber, because there is a lot of talk about having a plant-centered diet for gut health, increasing your fiber intake. I think, again, this is highly individualized because there are certain gut conditions where we may need to play around with your fiber intake, and the guidelines of these 30 grams of fiber per day may actually not be suitable because you might be prone to loose bowel movements or diarrhea. So this is where we need to sort of taper off or play around with the different sources of fiber.
Okay, so what I've sort of taken from what you're saying is if you're bloating, understand what is normal for you. So everybody has normal, and on a scale of 0 to 10, up to 5 is probably acceptable, depending on what you might have eaten or how you've eaten, time of day, and all of those sorts of factors. But once it starts to regularly go over that, that's when perhaps you should go and seek help.
Exactly.
And the two most obvious ones that you find has been lactose and constipation for the main causes of those two. And I can see when you said that they all sort of roll into one. If we now move into IBS, we've just moved into it, haven't we?
Absolutely. And just a little side note as well. Now, when in doubt, I always advise anyone to keep a food and symptom diary for at least a week. So I would even add stress levels and sleep to that diary too, because that will help you perhaps identify patterns or even, notice if a specific food is a culprit or is it multiple foods. So this is where I would say, generally speaking, before you do approach a dietitian or registered nutritionist, just make sure you've had that, 1 week's worth of food diary where you just note down everything that you've consumed in great detail, not just note vegetables, list all the vegetables that you've had, herbs and spices as well, everything that you've consumed in terms of beverages. You can note down your symptoms. You can even note down the timing of your symptoms. What you can also do is, rate your stress levels, put down the type of poo. So, we used a Bristol stool chart to actually, get a classification of what type of poo are you. And note down your movement and your sleep as well, because then you're able to identify these pattern or potential triggers too. So this is a little side note, because I also get to do that with all my IBS patients. Now, patients, I like to call them clients. I'm no longer in a clinical, as I said, I'm not in a clinical setting anymore. But when it comes to irritable bowel syndrome or IBS, again, it's extremely common. And generally, if I had to ask you within your social circle, do you know people with IBS?
Yes, and I know that within our Talk Health community, it's prevalent, you know,
Yep.
from both self-diagnosis through to people going to the doctor and the doctor saying, yes, you've got IBS. But actually what has been found is that most people don't find that necessarily helpful, because they might say, well, you've got IBS, well, there you are, tough. That they don't then go on to say, well, these are the things that you need to start looking at or being aware. And you know, I think what you said about taking the diary. So yes, we all know specifically for chronic health conditions, it's very good to diarise so you can see. But it's a really good idea, especially because, you know, we're saying how hard it is to get an appointment. If you can go in already with some information to give your healthcare professional straight away, you're that one step ahead on your dates.
I completely agree. I was going to say you're already doing part of the work as well, because that can even just help, whether it's a dietitian or a gastroenterologist you're seeing, they are going to ask you about that diary if you start to notice certain triggers or patterns too. But when it comes to irritable bowel syndrome and this whole concept of you've got IBS, tough luck, it's actually, I mean, hopefully it's changing. We've evolved more than that. And if we had to look at the definition, so IBS is, I mean, used to be called, I'm not going to say used to be called, it still is called a functional gut disorder. And what a functional gut disorder is basically there's a glitch in how your brain and your gut are communicating. Now, there's a recent rename of functional gut disorders. They've renamed them to disorders of the gut-brain axis or the gut-brain communication, because again, it gives that legitimate, you know, it is a legitimate gut condition purely because patients felt stigmatized if they've been smacked with a label of a functional gut disorder, that, you know, doctors aren't going to take them seriously. But your symptoms are very real, and they're just as real as if you would have had an organic cause for your symptoms as well. So IBS is a disorder of the, you know, of the gut-brain axis. Now, because of this glitch, what tends to happen is your gut muscles are impacted. So in IBS, we do know that this glitch in this bidirectional communication pathway can either cause things like diarrhea, constipation, a mix of both, accompanied with things like stomach pain and bloating. Now, the causes of IBS, a lot of time, you know, for such a long time, we had no idea. But what we do know, it's a mix of different causes. So one, as I said, it's that glitch in this gut-brain axis where this communication pathway is disrupted. The other thing is probably there's a change in the microbial, you know, we call it the microbiome composition. So the microbiome, again, is that inner ecosystem, basically. So this is like, you know, the trillions of gut microbes that reside within our digestive tract. And what they've seen is that potentially there's something called, again, this is a very generic term, is an imbalance of your gut microbes, which is called dysbiosis. Now, dysbiosis is always a funny word. It's also, I'm sure you've come across the term dysbiosis, but it is, you know, it's not as simple as, let's say, social media might make it sound like you've got a dysbiotic microbiome. What does that mean? So actually, it can involve any of the three points that I'm just about to mention. So when we're talking about dysbiosis, it can be a change in the microbial diversity. So how rich and diverse is your inner ecosystem? It perhaps could be a change or a reduction in the number of all the beneficial microbes that we have, or it can maybe involve a change in the function of how these beneficial microbes let's say function, basically. So dysbiosis, a lot of people always assume it just simply means more bad bacteria or bad microbes than good microbes, but there's more to it. So that generally is one of the causes as well, or potential causes of IBS. Stress is another one. Again, stress is, or it is, I'm not going to say the simplest example, but it is an ideal example of your gut-brain axis at play. You see that with stress, you see that with anxiety as well. So as soon as you're in an anxious situation or extremely, high stressful situation, you will notice your gut play up. You will experience bloating. A lot of our clients, including myself, would experience diarrhea. perhaps a mix of both, perhaps you're extremely bloated. So again, stress can definitely or negatively impact how your gut muscles contract and then causing these symptoms. And then again, one of the other causes, which actually is something that I do see quite often in my practice, is post-infectious IBS. So this is also perhaps in my case too. So you've picked up a tummy bug and then your gut has never been the same since. So these are generally the potential causes of IBS. And then when it comes to the management approach, I always say if you have been diagnosed with IBS, and again, there is a diagnostic tool and there's a whole diagnostic process behind, coming to that conclusion of IBS. Doctors or specialists will use the Rome criteria, for example, but there's a number of tests that you will need to do to rule out other conditions, because as I said earlier, a lot of symptoms tend to overlap when it comes to these different gut conditions. So I just wanted to quickly note, a dietitian cannot diagnose you with IBS. A gastroenterologist will. No one else is going to diagnose you with IBS. Do not self-diagnose, because you can be missing out on other gut conditions as well. So you need to make sure you get your diagnosis from, real specialists who are qualified to do so. Right, where were we? We're talking about management, right? I was going to say, I've been talking for a bit, but management of IBS. Think of these 4 pillars: mind, movement, nutrition, and sleep. Your management approach has to include all 4 pillars. And when it comes to nutrition, because again, it's the focus of what I do. Again, I don't want to go into too much detail, but one thing that I tell my clients is we're not going to jump on any elimination as quickly as we can, because it still can be quite restrictive. So when it comes to IBS, there are different lines of approaches. Generally, the first line of approach would be things like cutting out common culprits. We always address alcohol and caffeine first, and then potentially looking at other triggers like fatty foods. We can look at spicy foods, and then we can look at things like how much fiber is in your diet. So even adjusting your fiber intake can even help offer some relief when it comes to the digestive symptoms you're experiencing with IBS and the type of movement you're doing as well. So that's generally that first line of therapy.
That's kind of interesting, because whenever you hear IBS, then suddenly you hear, oh my God, I need to go on a low FODMAP diet, or something like that. And you think, oh my God, that's so extreme. And clearly that is extreme, particularly, depending on how severe your symptoms are. And I think that you do actually see always advise, do not go on to one of these diets unless you have been told by a specialist that you need to go on one. And then I think the other one, and I know that we've mentioned this before, is how people, particularly if they've self-diagnosed, they will go on to low FODMAP diet and they don't come off it.
No. And this is another thing that we see. I think people don't, I'm not going to say they don't understand that the consequences or the cons of being on the low FODMAP diet for a long period of time. But if you've struggled with your gut for a long period of time and finally you've had this relief, there's also that fear around food as well that gets, that gets ingrained somehow. And they just can't get off of it. And this is why I always say it's really important to do that under the supervision of a qualified dietitian or a registered nutritionist, because it is not a long-term diet. And actually, I don't like to call it the low FODMAP diet, because there's a whole process behind it. It consists of 3 distinct phases. The low FODMAP diet is only that first part or that first phase of that whole process. And it should only be done for about maximum 6 weeks before we move into phase 2. So for those who are probably unfamiliar with the term FODMAPs are these just fermentable sugars that are poorly absorbed in our gut. And what they tend to do is our gut ends up absorbing so much liquid and gas, causing things like constipation or diarrhea, a mix of both stomach pain and bloating. And because people with IBS do develop something called visceral hypersensitivity, meaning they've just got an extremely sensitive gut. So the slightest bloat is causing alarm systems to go off, and then potentially even exacerbating their symptoms even more. So what we found is that if we reduce the amount of fermentable sugars in a person's diet with IBS, perhaps that can offer symptom relief. So here we're not trying to cure IBS. There is no cure for IBS, but when we're looking at the FODMAP process, it's purely for symptom control. So it serves two purposes. So one is to identify if you are sensitive to a specific FODMAP group. And B is to actually see, all right, how much am I able to tolerate before I experience certain symptoms? And that's actually the role of phase two. So once we've eliminated, so we've gone through that low FODMAP diet, we jump into phase two, which is the challenge phase or the reintroduction phase, where you start using tester foods from these different FODMAP groups just to test out, right, how does my gut feel? Am I extremely sensitive to it or not? Or that FODMAP group is completely fine. And I feel like it's crucial to go through that second stage purely because a lot of these high FODMAP foods that we've been eliminating are actually beneficial for gut health. And funny enough, so if my clients, are extremely sensitive to a specific FODMAP group, I actually retest them in about 3 to 6 months' time just to see if they're able to tolerate things more. Perhaps they're in a much better mental state. Their stress levels are managed, much better than it was when we first started off. And they're like, hold on, I can actually eat onion again without having to run to the loo. So this is why I would say, it's definitely not a diet to follow long term. Make sure you go through all the phases. So the first phase will be the elimination phase. And actually what I try to do is, if my clients are asymptomatic, let's say they find symptom relief within the first 2 weeks, I'm not going to wait for another 4 to 6 weeks. I try to get them off of it as soon as possible. We go straight into the second stage. And then the third stage, or the third, is the phase of liberalization phase. This is when you start bringing foods back in strategically, not to exacerbate your symptoms. So the reason why I wanted to highlight that is there's a process behind it. It's not just a sheet that you should follow and then eliminate long term.
No, I mean, I don't think I've ever had it explained so simply and so obviously, which is great. So really, with IBS, I think for me, the things are that you have to be tested, or you could only be diagnosed by an actual I can't say that word.
Gastroenterologist.
One of those. I'm rubbish, as everyone will know, I'm rubbish at words. Yes, you need to have one of those to diagnose with you. And then it's clearly looking at all of the reasons. And it could be that you find that it is the stress that is your trigger to give you the IBS. So why on earth would you want to go onto a low FODMAP, really strict diet if you haven't addressed some of the things that may be very obvious? So it is
absolutely
at the whole thing. And what I always find it odd. Why would you want to eliminate a whole load of foods when because it makes cooking, going out, another difficult. I mean, it's hard enough to get people to cook fresh food anyway, but specifically if then you're down to just a few ingredients that you feel you could use. And as you said, you're missing out on vital minerals and vitamins and fiber and all of those things. And then I suppose that the next bit then goes on to the food intolerance side of things, where people say, I'm allergic to that. I can't possibly eat that. What happens there?
I think, look, when it comes to food intolerance and allergies, the terms are always used interchangeably, but there are obviously very distinct differences. So just to quickly clarify, so in simple terms, when we are referring to a food allergy, we are referring to an immunological response. So a food allergy is your immune system's response against a specific food protein. So it sort of responds to that food as if it is a harmful food. It kind of attacks it. So what happens is it releases these compounds, or we call them antibodies, specifically IgE antibodies against that specific food protein. And that results in the allergic reactions that follow. So it can be very mild to very severe and fatal. So food allergies can be fatal due to something called anaphylaxis or anaphylactic shock. So that's basically when your breathing is impacted, things swell up, you cannot breathe anymore. The difference between an allergy and intolerance, this is where I would say that the key difference is the immune system. When it comes to a food intolerance, by definition, it is a immunological response to a specific food or food component. So let's say if you've consumed a food or food component, caused a chemical reaction. So basically what happens, a chemical reaction happens, doesn't involve your immune system, but it irritates your gut, but it also irritates different parts of your body, including your nervous system. So what we see with a food intolerance is that it's not just confined to your gut. It can be quite systematic. It can influence different, let's say, systems of your body. So what we see, for example, neurological symptoms of food intolerance are things like migraines, headaches, brain fog, as well as things like potentially hypertension, for example, when your blood pressure drops, causing dizziness. The other thing that maybe perhaps if it's going to impact your respiratory symptom that we see with food intolerance are things like rhinitis or nasal drip. The other thing that can be seen, let's say, with skin conditions as well. I mean, like skin issues like eczema, for example. So bottom line is, food intolerance is actually a very, very difficult thing to diagnose because it's, again, not so straightforward, and it really impacts not just your gut, but a whole bunch of other systems too.
What do you think about, because a few years ago for sure, there was everywhere was go and get a test. We'll test you. What do you think about those tests that are out for £99?
So if anyone that knows me know, I speak highly against these tests because we do not have a test that can diagnose a food intolerance unless we're talking about lactose intolerance or perhaps something called fructose malabsorption. But all these commercial tests that you can get done at home, the problem is these tests are unorthodox, unreliable, and are just not accurate. If we had to look at the mechanics of it, because sometimes, clients will tell me like, why? But that what happens is, by blood or saliva, you get this massive list of foods that you should be eliminating. And I can guarantee that 99% of the time on your test results, gluten and dairy are going to pop up. So sometimes I can even predict the results of the tests when my clients come in. Now, if you had to look at these tests, specifically the ones that use these specific, let's say, antibodies, they're called IgG antibodies. And these are basically just specific antibodies that are produced in result to, being exposed to certain things, food components, environmental toxins, viruses, etc. So if anything, what these compounds show us is just exposure rather than a diagnosis. So one way I'd like to use it as an example is right now, if we, after COVID, if we want to test if we've been exposed to COVID, we actually test for these IgG antibodies to check if we have been exposed to that. So that's the same thing when it comes to food. These food intolerance tests actually do not reflect an intolerance. If anything, they do reflect a tolerance because you've been exposed to these foods for a long period of time. The only way to diagnose a food intolerance is, again, to go through an elimination diet, but again, only under the supervision of someone, because there's, again, a process behind it too. So generally, an elimination diet is done where, obviously, depending on the type of food intolerance we're looking into, are we looking into something called an enzymatic intolerance, like lactose intolerance? Are we looking at a food chemical intolerance? So there's a lot of naturally occurring food chemicals or additives, ones that are added to foods as well, that we may be sensitive to. But then also looking at FODMAPs, that is also a type of food sensitivity or food intolerance too. So there are different types. And again, going back to that food diary, this is where I actually start to find it quite helpful for me to judge, hold on, am I looking at a FODMAP sensitivity? Am I looking at a food chemical intolerance? Is it lactose? Is it dairy? So this, again, having that information beforehand can even dictate what sort of approach we'll be taking.
Funny enough, as soon as you started talking about it, I was thinking, oh yeah, you should definitely be taking a diary on this one. To work
absolutely.
out.
With food intolerance, anyone that comes, or just requests an appointment for a suspected food intolerance, obviously there's certain tests that need to be done as well to rule out XYZ depending on the symptoms. But generally on a person's team, we've got myself on board, we've got the gastroenterologist, but sometimes we need a clinical immunologist or an allergist on board too, just to make sure we rule out if we're dealing with an allergy, or perhaps this is a delayed allergy. That's a whole other topic for another conversation. But also, you know, when it comes to food intolerance, it is a very specific area that not a lot of people have experience with. I mean, even gastroenterologists are not trained to, you know, to be able to advise or manage food intolerance unless they've been working in this area for a long period of time, especially with food chemical intolerance.
But it is interesting that you say that, considering that we all think that we're a bit of experts, but along with the help with Google, we can go and sort everything out. I mean, it just
well, it's AI now. We've got AI, right now.
Yeah, it just doesn't work. But Sandra, it's been a real pleasure talking to you, and I really did enjoy reading your book. I found it really interesting to understand how my own body works in a way that I can understand, which is obviously simplistic, but it really really works. So thank you so much for your time today. Thank you.
I was going to say, thank you for giving me this opportunity to talk about poo and gut health. You know, I will take that on any chance I get. But as I said, your feedback is exactly what I want my readers to feel.
Excellent. Well done. Thank you.
Cheers.
Bye, everybody.
Thank you.